Today we're here to talk about the important role that broadband plays in these efforts, particularly in rural America. The companies that I represent are committed to extending broadband's reach and opportunities into every community. In doing so, we are continuing a great American tradition of building new opportunities. I would like to introduce you to some real-life heroes who are taking broadband and making it meaningful in our communities. Our guests today represent just some of the many community leaders across the country who are standing together to make the case for the importance of broadband to the American quality of life and the importance of policies here in Washington that encourage continued vigorous investment in the capacity and reach of these vital life-enhancing networks.
Arkansas, as you probably know, is very rural. And one of the things that we started about 4.5 years ago with the advent of technology was telemedicine. And we didn't know how we were going to do it or whatever, but we knew there were some important things. Number one, 55% of the births across the state of Arkansas are covered by Medicaid. So we knew there were issues there. We were having patients who were high risk, had to come all the way to Little Rock, no matter where they lived in the state, because that's where the subspecialists were. And these communities that we were trying to reach didn't have the health care that they needed to be able to prevent them. So we decided we were going to start with 6 sites. And we deployed it in eastern Arkansas, which is the big Delta area, very poor, some of the poorest in the nation. Then we had places like Hot Springs, that was still about an hour away. But because what we realized was if a patient couldn't make it to Little Rock, they may not even be able to make it to their local hospital because of transportation issues, because of money. They may have other kids at home that they can't find help to take care of. People in Arkansas care. And people in Arkansas deserve the best that we have. We may rank low, 46 overall in health care, but I can tell you today, because of what broadband has done, where we are going with the technology that's available today, we are one of the top states in the United States that is utilizing this to bridge that access gap. This is going to give access to our patients that hasn't been seen since they built a hospital in every county. We have a program called Angel Life. You have a 28, 29-weeker, those babies are going to be in the intensive care nursery for probably about 2 months on average. But the parents have to go home and work. They have other kids that they have to go home and take care of. There's a lot of bonding process that we're missing. Now we have a webcam that's on every one of our intensive care nursery beds, so the parents can pull up on the web and they can look at their baby whenever they want to. We call it virtual visitation, if you will. But they can call, talk to the nurse, say what's going on. They can actually see their baby. They can zoom in on the baby. They can do different things and whatever. But it's making that connection. Again, the technology is cool, but what it is making that connection. And between a mom and a baby, there's nothing better than being able to start that bonding process and when it is time for them to go home.
The interesting thing about Marshfield Clinic that I like and makes me proud to work there is about 70% of the care that we deliver is in rural areas in the state of Wisconsin. And in 90% of the communities, we are the only healthcare provider. So that really positions us uniquely to try and take care of the needs of the populations in those communities. We have a lot of resources available to us, and one of the reasons that we have this is the availability of getting data around on broadband networks. We have our own electronic medical record. You may have heard of it. It's the only privately developed electronic medical record in the United States that's CCHIT certified. It's called Cattails. We have our own, basically a system-wide telephone system, so you call anywhere on that map and it's a 5-digit telephone call, just like calling down the hallway in your own building. We have teleradiology and PACS available. We use wireless tablets for clinical care, and I'll show you some examples of that in a little bit. We have off-site services that, again, connect back to the main clinics through the broadband access. We have interactive and store and forward telehealth activities, and we also have a huge distance education program that provides CME, CEUs, and community education. Our telehealth exam rooms and connections are in all kinds of places, and that's what makes this really a valuable way to deliver healthcare, is you can do this anywhere. We have Indian health centers connected to us. We have schools connected to us, county jails. We have 10 Head Start centers, nursing homes, dental clinics. We have a whole dental network. So again, telehealth really eliminates all the barriers of distance and time and geography in terms of getting health care to people when and where they need it. What makes this all possible, as most of you know, is the networks and the broadband that's available out there. That's also something that I guess creates a barrier to getting this done. If it's not there, it's difficult to do. And in terms of what's available across the spectrum, certainly a lot of care can be delivered over the phone, the simple POTS lines, getting into the home. But if you want to do the more sophisticated clinical care, you really need to get the bandwidth up. So we're talking about lease lines, wireless, and internet, and that's really kind of where we need to move over time, is to get more access to those types of lines so that we can deliver more sophisticated healthcare services.